All right, Dr. Henderson talking in this video about stress incontinence and specifically a newer type of treatment called Bulkamid. Bulkamid is not a new idea, it's just a new polymer that we use as kind of a filler or a bulking agent in the urethra. When you have stress incontinence, we can bulk up your urethra and it kind of causes outlet obstruction, but it also can stabilize the urethra. So the biggest thing that we used to use with this was something called coaptite or Durasphere, and these were just different kind of bulking agents that we can use under the tissue to bulk up your urethral tissue so it closes in more, and then your sphincter is more efficient closing down so you don't leak as much. This Bulkamid agent is a polymer that bulks up the tissue, but it also kind of stabilizes or hardens in there and stabilizes the urethra so urethra isn't sliding, and that's what you want when you talk about urethral slings or you talk about Bulkamid. Is you want that urethra to not slide through so that the sphincter muscle isn't trying to close around your bladder neck, it's trying to close around your urethra, and that'll stop the leakage. Bulkamid is a great thing where you could try it if you have a very small amount of stress incontinence and you don't want to quite put a piece of mesh or the sling in there, and you can look at my other video for the single incision slings that I do that are very, very effective for stress incontinence with women. When you cough, you sneeze, you leak. Bulkamid is a great other option to that if you have a very small amount of stress incontinence. It's not going to work as well probably for the large stress incontinence. That's where the sling would come into play. The other time I've used this is not as a primary, the first option of treatment, but once we put that sling in, if anybody has any sort of leakage afterwards, they could consider doing the Bulkamid in addition to the sling. Now the sling's in there, and with those two together, I've seen patients do very, very well. Again, the sling is very effective, and so it's not very often that I have to do that. Other options that you can always look into is they have laser therapy, saying that helps with stress incontinence. I've never had any of my patients tell me that it really helped enough unless they had a very, very, very small amount of leakage that didn't require a pad or something like that. But if you're already doing a pad or something, I would consider this sling, or you can consider this Bulkamid agent. Afterwards, we don't even leave a catheter or anything in. We just want to make sure that you can void before you go home. It's a same-day procedure. It's little injections in the urethra, and so there's not a ton of bleeding or anything like that, and there really is no recovery. Within 24 hours after the anesthesia, you're good to go. So great procedure. I'd encourage you to look into it.